Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive. Smooth 98.1, love music, love life. This is Smooth Health. Now today we're talking about blood donations, in fact the blood donor drive, and its importance to the nation. Once again, you're welcome to Smooth Health on the Drive, brought to you by Evercare Hospital, Lekki. We have a special guest with us today.
Yes, we've got Dr. Adewoyin. He is currently a consultant hematologist at Evercare Hospital, and his core clinical competencies include clinical hematology, anemias, bleeding disorders, thrombosis, blood cancers, and also transfusion medicine, and also laboratory medicine as well, and clinical pathology, in addition to quality management systems, healthcare leadership, as well as leveraging technology to improve clinical outcomes.
All right, Dr. Adewoyin is a member of the College of Nigerian Pathologists, Royal College of Pathologists in the UK, the International Society of Blood Transfusion from the US, and the Canadian Academy of Pathology, as well as the Institute of Strategic Management here in Nigeria. Dr. Adewoyin is active in clinical research, including trials, with over 25 published works in peer-reviewed journals, as well as abstracts at international conferences. Welcome, Dr. Adewoyin.
Yeah, thanks a lot.
Good to have you here.
Yeah, it's a pleasure to be here. Thanks a lot.
All right, if you want to be a part of our conversation, please call the number 0144899981, or just send a WhatsApp message. Please send it to 080944400981. Much like Zibi mentioned, we're talking about the blood donor drive, the importance of blood donation on the show today.
Okay, doctor, can we start with the process of blood donation? How exactly does it work?
Right, so blood donation essentially has to do with collection of blood from a donor, as the name implies. So what that means is that we try to get some volume of blood from the donor. So on the average, an adult has about 5 liters of blood. So we target collection of about 10% of that, which is about a pint, and that's 500 mils. So that's what it is really.
All right.
500 mils.
500 mil. Well, sounds like a lot.
Yeah,
is it a lot, really?
You know, sometimes we do not collect as much as that. So we have different collection bags, so they are the smaller sizes, 250 mils, 350 mils, but I mean, on the average, we use the 500 mils bag.
Looking at my size, can I give out 500 mils?
Yeah, so, typically, again, in the bags, you're going to have some, what we call anticoagulants.
Okay.
Those are usually about 63 mils, and then you had about 450 mils of blood. So that gives about 500 mils on the average in the bag.
All right. Okay, so, giving out this blood now, how long does a blood donation take? And how long, does it take to recover the blood that's been given out?
Right, good question. Now, the process begins with some pre-donation exercise where we try to assess the fitness of the donor for the exercise. So that's going to be requiring doing some questionnaire. So we're going to give a pre-donation survey or questionnaire to sort of get to know the donor and assess for fitness. So if there are donors who have some particular health condition, of course, they will be deferred from donation because you don't want to take someone healthy to a disease state.
True.
Now, the next thing then, once you find a donor fit, is to collect the blood, and then there are some post-donation, preparations or some sort of post-donation exercise that also has to go into it. So, I mean, if you look through the process, on the average, about 30 minutes.
30 minutes.
Yeah, 30 minutes. Except, some instances you have some exceptions to the rule. For instance, difficulty of getting the vein to collect the blood. So that might cause some delay in the process, but on the average, about 30 minutes.
Okay, but how long does it take to recover? Because, I'm giving out 500 ml of blood now.
Right.
That sounds
That's
like a lot,
10%
right?
of your body blood.
Right. Yeah. So if you go to the physiology of it, by the time you take about 10% from a person, you're going to lose about a gram. So let's say your pre-donation hemoglobin is about, let's say 14. So by the time you take a bag of blood, you're going to take it about 13. So you lose about a gram, which is still good. It's still within normal range. So that's why there's a pre-donation hemoglobin check. And if you don't meet the criteria, we're not going to go ahead with the process. Yeah.
So I've seen pictures and videos of people donating blood. Sometimes they're sitting down and they seem to just, be having conversations. Is that always how it's done? Do people need to lay down?
Yeah. So, sitting, and we tend to use this reclinable chairs, so that you're as comfortable, you can stretch out on the chair, so it's either sitting, lying down. It's also dependent on the preference of the donor, but oftentimes it's a sitting reclinable position so that you're comfortable, and then we can stick in the needle into the arm to collect the blood.
Wow. He says stick in the needle. All right. If you're out there and you're wondering what we're discussing today, we're talking about blood donation. And if you've got questions, about blood or the donation process, amongst other things, feel free to call us. Call the number 0144899981. Now, Doctor, I have how do I put this now? A curious and fascinating question to ask you. So people with tattoos, body piercings, can they also donate blood?
Yes, they can.
They can?
Yeah, so this is arguable, but the principle is what should underscore the response. So the idea is the more exposures to body arts in general, tattoos and body arts, the higher the risk of infections. So because pretty much you're going to be using needles and sharps to create the tattoos.
Okay.
And there can be possibility of contamination of these particular items or instruments in use, so there can be transfer of infections. So that's pretty much the rationale. So, but if you have a donor and there is a need for blood, and then you take the person through the routine, the exercises, and the person is free from infections you don't want to transmit, why not? But in some systems here, you have a very high, number of donors, and you have enough volumes. You're going to sort of put that as a barrier to limit the number of testings you have to do to select healthy donors. So the protocol is not cast in stone. It's a question of what your institution, puts as a protocol and what you do.
Okay, Dr. Adewoyin, we've spoken about the process of donation. Can you tell us about how actually after the donation, the transfusion or transfer can actually save a life?
Right. So, the bit is blood is always given once there is a need. So before you initiate the process of transfusion, there has to be a need in the recipient, and that's the patient. So that need differs. So there are different components in the blood. So largely speaking, there is the liquid part, which is the plasma, and then you have the cells in the blood. So you have the different cellular components. So you have the red cells that make the blood red. You have the white cells. You have the platelets. Now, so if a patient has shortage of blood, in the sense of anemia, what we typically describe as shortage of blood, you're going to get the red cells and infuse into such a person. So there has to be an indication, and then that informs the need to request blood from the blood bank to the patient.
All right. Okay, so, speaking of, that saving lives, then tell us, what are the benefits really? Because, so I have my blood. I'm holding on to my blood. What are the benefits of being a blood donor?
Yeah, so, are
there benefits?
Yeah, absolutely, there are benefits. And I think we should look at it from two angles. One is the benefit to the donor. So the donor has this sense of solidarity because you're giving something.
Okay.
The donor has this sense of altruism. You're saving a life. Some persons are in a deep and they can't help themselves, so you're helping them. So that's a sense of fulfillment on the sense. Now, the donor also giving out blood makes your marrow active. So when you donate, it delays the process of aging of the marrow.
Wait, aging of the marrow.
Right. So everything in the body ages, including the bone marrow. And, all the blood cells come from the bone marrow. So just like the liver ages, the kidneys age, the brain age, everything ages when we grow older. So when you donate, and just like actively using a muscle in the body, if you're not actively using them, they're going to age faster. So that's what happens when you donate as well. Pretty much you delay conversion of the red marrow to the yellow marrow and then to the white marrow, which is fibrosis and is no longer active. So that's the benefit.
So I can shave off 2-3 years from my age if I keep donating.
Well, yes. I mean, you can keep the marrow more active by donating. Right. Now, the benefits again also accrue to the recipient, and of course, that is simple. It's saving lives. So there are benefits to donation.
Right, this is Smooth Health on the Drive, brought to you by Evercare. Would love for you to be a part of the conversation. You can send your comments or any questions that you have to us via WhatsApp. The number is 0809 444 0981. You can also give us a call. The number to call is 01 4489981. We're speaking with Dr. Ademola Adewoyin. He's a hematologist and a laboratory physician. We'll go on a quick break, and when we return, the conversation will continue with the doctor, and of course we'll take your messages and your phone calls.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
You better know it's always Lagos.
Smooth.
What is your Lagos? What is our Lagos? As long as I've got the air that I breathe, you better know it's always Lagos. The city of hustle, the center of excellence, where dreams come true, as long as you're not sleeping too much. My name is Maka, and this is my Lagos. Smooth 98.1.
In this country, we rise as one nation.
Individual inspired by a dream for the pursuit of happiness. One people of similar mind, bound by a common goal. One nation, united, indivisible, driven by purpose of life. One world, by creation under one heaven, for love, peace, and unity.
Non-violence was the only weapon.
In a world where music is king. One station of music and life, reaching one individual, one people, one nation, one world, one dial, 98.1.
Welcome back. This is still Smooth 98.1. Love music, love life. We're speaking with Dr. Ademola Adewoyin. He is a, of course, hematologist and lab physician with Evercare Hospital. Today we're talking about the blood donor drive, the importance of blood donation. And we'd love for you to, call in and let us know your thoughts about, giving blood. Do you have a tattoo? Do you not have a tattoo? Do you want to know why you can give blood? Do you want to know the benefits of it? The number to call is 014489981 to be a part of our conversation this evening.
All right, doctor, I have a question. I've heard people say they'd like to donate blood, but they have issues with donating blood and it's not immediately transfused into a patient and it's stored in a lab somewhere. So I'm curious about this. How long can blood that's been donated be stored for?
Yeah, thanks for that question. It's a question that is not a straightforward answer. But on the average, we store blood components, the red cells, for about 28-30 days. So that's a month. And it's dependent on the kind of anticoagulant that we use. So, for instance, if you were to use something like ACD, anticoagulant, it's going to be about 21 days.
What's an ACD?
That's acid citrate dextrose. Those are a bit technical. So the regular thing we use is the CPDA1. That's the citrate phosphate dextrose adenine 1. So there's CPDA1, there's CPDA2. But of course, there are other anticoagulants. There's the Sagem, and these are more like optimal additive solutions. So it depends. So those ones, the optimal additive solutions, they can keep blood for longer, up to 42 days. But on the average, about a month, that's what the length of storage that we give to blood components. But again, there are different blood components. Red cells is just one of them. So you have things like platelet concentrates, and those have very short shelf life, pretty much about 5 days. You also have the plasma, and those ones last very long. So you have them, you're able to store them up to a year, under freezers, in the freezers. So it pretty much depends on the nature of the blood component and then the sort of anticoagulant that we use.
All right. Okay, so now that we know how blood can be stored, what qualifies a person as a blood donor? And also, why is it important that people donating blood are qualified?
It's important to ensure that people donating are qualified, because you can't just grab people on the street and subject them to donation. And so
what if they're healthy and say, hey, you know what?
No.
You look like a healthy person. Come to our clinic.
You need to qualify the health, because it's not just about collection. You have to ensure safety of both the donor and the recipient. So the whole process is about, what we call vein to vein, is about ensuring safety of both the donor and then the recipient. So if you collect blood, you need to be sure that blood is collected from someone who has the right motives. And that's because people who are described as commercial or paid donors, they have a high risk of transmitting infections.
Commercial donors?
So you do not want...
I think we should even talk in line of commercial donors.
So
I've never heard
the
of
layman
that.
term is like blood touts, and you see them parading around blood banks, trying to peddle their blood for money. So those kind of blood donors, they introduce a high risk of infections, and then typically because they overdo it, so they usually have shortage of blood, and then you're going to have poor quality blood.
It feels like
they
will have a shortage of blood, truly.
Right. If you follow the news, there was this time there was a guy who was sort of having some sort of outlet in Bariga, and he bled a 17-year-old boy about 3 times in a month. And by the 3rd time, the guy collapsed. So these are the kind of things we're talking about, and they are not encouraged. And government in no way will encourage that. So he was nabbed, and then he
was prosecuted.
Yeah. So that's the bit. People have to be qualified to donate, because you need to be sure that the donor has the right motives. You need to be sure that the donor is free from infections, because you're not going to transmit infections to the recipient. And then you need to be sure that the donor is doing it out of free will. You're not going to just grab people on the street and then just subject. So there's a consenting process on pre-donation exercises, and then be sure that the person has the right quality of blood. So if your hemoglobin is not good enough, we're not going to take the blood, because we don't want to take blood and you collapse right there at the point of donation.
Wow. So you spoke about an incident, involving someone who had donated too many times in a month. So is there like a specific number of times that, as a professional, you advise that a donor can give, a time frame?
Yeah. So that we don't overdo it and send the person anemic, it's advised you donate not more than 3 times in a year, and you shouldn't do it at shorter than 3 months. So not more than 3 times in a year, not less than 3 months apart.
All right. Well, sounds decent. Okay, so we know that storing blood is good. Donating has, its good benefits amongst other things. But I'm sure that there might be side effects. Or are there side effects? And also, are there disadvantages of, donating blood?
Yeah, so they are what we can describe as donor reactions, and that's something that rarely occurs if you select your donors carefully. So an example of donor reaction is faint. So you can collect blood, especially from first-time donors, and they can faint. So there's also a time we call...
Why? Because they don't have enough blood to give?
No, not really. It's because it's some sort of autonomic discharge, and they just sort of lose it, So it comes in different levels of severity. So some feel dizzy. Of course, you've also taken blood, especially when they come really dehydrated, So some feel dizzy. Some actually go to faint. So there's pre-syncope, there is syncope, and then some can experience what is called a vasovagal attack, which is the extreme reaction of it. So that's why once a person finishes the donation exercise, we don't tell them just go back to your job. We tell them to stay around. we keep them for an additional time to just be sure that they're not going to faint or experience any sort of dizziness.
All right. So in most cases, the blood that's donated goes into another person who needs it. But what happens to perhaps some of the blood that no one needs at the moment?
Yeah, so we're going to store them until it's needed.
You spoke about the shelf life, or how long they can last for, 21 days in some cases.
Right.
And so what happens to the samples or the blood that has been collected and has that shelf life, if that's the word?
Yeah, the blood bank operates on a number of principles for efficiency. So there is the lean management protocol, where you're not going to do a drive when you have adequate. So there's a minimum stock you want to keep in your bank based on the clinical need. So if you need more, then you have to drive more and get more. But if you drive a lot and then you get excess blood and then they're going to waste away, that is not a good practice, because you don't collect that precious fluid and then be discarding at the end of the month. And then, of course, there's also a principle of first in, first out. So the ones that come in first are the ones that go out first, so that you can maintain, a very good stock, and then you don't have some, losing viability and then expiring on you, and then you have to discard them.
All right. Thank you so much for that, Doctor. Well, we're about to wrap up this side of the show, but before we let you leave, we've got a few more questions to ask. And for our listeners that just joined the show, we're talking about blood donation, the blood donor drive, and I'm sure a number of people are wondering how the process works. However, we'd like for you to quickly run through, how the process works, who is eligible, in one sentence, and also the benefits of this, and how often that person can come back or donate.
Right. So the process is pretty straightforward. Once you are interested in donating, you pretty much go to a blood collection center or a donor center, and once you arrive at the donor center, you're going to be taken through some routines. So that would include some questions. We need to be sure you've eaten. We need to be sure you slept well. We need to be sure you're free from some certain health conditions, so that we don't put you at a bigger risk. And then we do some health checks. So we're not going to check your vitals, your blood pressure. We're going to check your temperature. We're going to check your hemoglobin level, your blood level. And then once all of that is good, then we'll go into the proper donation exercise. So we collect the blood, and that roughly takes about 10-15 minutes depending on the rate of flow. And then we just observe you for a little time, and then that's the process.
All right. We've got a few messages here. One that stands out from this person. No name to this one, though. He says, good evening, Zibi and Kaide. Is it possible for blood donated to affect genetic materials, DNA of the recipient?
Right, that's possible, but that tends to happen for those persons who are immunosuppressed. So there are some category of patients that have this depressed immunity. So they do not mount any sort of host response to foreign antigens that they're exposed to, because once you transfuse somebody, you're exposing the person to foreign antigens.
Okay.
So that kind of situation, you can have a graft. So the blood is not just blood, as in helping the person. It's going to become a graft that can develop in the person. So there is what we call the transfusion-associated graft versus host disease. And we sort of, manage those category of blood recipients or patients in another way. So, for instance, you have a patient who lives with cancer, then we know there's a risk that kind of reaction can happen. So that kind of blood we're going to irradiate so that we can destroy the white cells that can
possibly carry the cancer cells.
No, that can induce that graft versus host disease that can cause a graft to build in the recipient of the blood.
Okay.
Right. So there can be some genetic implications, really.
Are there any standard tests that have to be done on a donor before they can actually donate?
So when you say standard tests, so pretty much what we do is to just be sure the person is fit. So there are going to be some physicals, weight, because if you're below 50 kilograms, we're not comfortable with that blood volume. So we're not going to take. Of course, you have to be of age, of consent, 18 years. And then, of course, we're going to check your blood pressure. If the blood pressure is hitting the roof, 240 over 150, we're not going to take that kind of blood, And then, of course, we do some labs. So we're going to check your blood group. We're going to check for viruses, HIV, hepatitis B, hepatitis C. We're going to check for syphilis. And then we're going to check the blood level. So if your blood level falls short of the standard, we're not going to take. So typically we use about 12.5 grams per deciliter. So if your blood level, hemoglobin, is in excess of 12.5, then that's great.
All right. Also, you mentioned pints of blood. We talked about 500 grams earlier,
500 mils.
500 mils.
Correct.
Wow, 500 grams is a lot. So how long will it take to replenish, if a regular donor walks in the clinic and donates as much as 500 mil, how long does it take for that to be recovered?
Yeah, so that again is not a very straightforward answer, but it depends on how the blood forming organ, what we call the erythron, how it works in the person. So, if all the what we call the erythropoietic precursors are there, we're talking about metals, vitamins, amino acids, some of the hormones that drive red cell production, erythropoiesis. If they're all there, on the average, in about 2 weeks, you should have restoration back to the baseline hemoglobin. So if you donated at 13 and you drop to 12, in about 2 weeks, you should have your hemoglobin rise back to about 13 in about 2 weeks.
All right, real quick before we let you leave, this person says, what happens if someone has white blood cells transfused into him or her?
Yeah, so those are what we call granulocyte transfusions. They are not a modern practice because of the advent of antibiotics, and they need the preference to use antibiotics compared to granulocyte transfusions. So pretty much we do not give granulocyte concentrate, but of course when you collect blood and you store it for a period of time, granulocytes don't live long, so you're going to lose all of them. In the buffy coat layer, they're supposed to be in the buffy coat. You're going to lose all of them because they pretty much live just in hours. Yeah.
All right.
Thank you very much, Dr. Ademola Adewoyin, for being with us on Smooth Health on The Drive. It's been a very enlightening conversation.
Right.
And I hope someone decides to help save a life by donating blood.
Exactly.
Right.
I'm sure our listeners out there wondering how they can contact you at Evercare Hospital. How can they reach out to you?
Right. So you can reach out by coming to the hospital located at number 1 Admiralty Way, Bisola Drosimi Eti Drive, Lekki Peninsula Scheme 1, Lekki, Lagos.
Okay. Is there a phone number? Is there an email address? Is there, a website that people can check out?
Right. So you could send a mail at info@evercare.ng. Phone number to reach 081-398-50710. And you can also access the website and send messages on the website at www.evercare.ng.
All right. Thank you so much, Doctor. Pleasure having you here. We look forward to seeing you at the clinic, probably coming to donate blood as well.
Sure.
Amongst other things.
Right. And that's it for Smooth Health on The Drive. Do stay tuned. There's a lot more to come on the Smooth Drive.
Smooth Health on The Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.